Recording. Okay, so attendance. Attendance is only recorded during your assigned live sessions, and it's taken by myself. Make sure to be counted that you have your full name signed in with how the campus knows you. You do have to be on camera the whole time. Can't be pointed at the ceiling. I need to be able to see your face so I know that you're actually there. If you are at work or driving during the session, you will be removed. And then if you're not on camera, I will ask you to come on camera. If you don't come on camera after being asked, then you will also be removed from the session and you'll be marked absent. And then your time in and out of Zoom will be logged, and that's what we use for your attendance. And it's recorded in 15-minute increments. So if you don't log on until 6:01, then you'll be marked as 15 minutes late. Anyone without posting attendance, so attending a live session 14 days in a row, can be dropped from the course without notification. And there is no makeup for missed attendance. So you have to be here for your live sessions. We do turn over attendance right after class to the registrar. Like I said, early departures, tardies, class cuts are recorded in 15-minute increments. Students that miss 20% of their scheduled hours for the course can receive a failing or reduced grade for the course. So it's really important that you're here. Like I said, students who are absent more than 20% of the time will receive a full letter grade reduction at the end of the term. Once you hit 5%, you'll get an email notifying you. At 10%, you're required to meet with myself. And then at 15% absent, then you're required to meet with myself and campus administration. And you may or may not receive all of those levels of warning. So it's up to you to be here. So key steps to success: make sure you're keeping in your syllabus. You know what's due each week. Make sure that you do the reading. If you don't do the reading assignments, then I can't help you learn. Make sure that you're attending your interactive lessons, or you're doing the interactive lessons each week. You're coming to your weekly sessions. So your weekly sessions will be a review of all of the information that's covered in the reading. So it builds off of that. You don't do your reading, you're going to be lost when you come to class. Make sure to read your directions and your rubrics for all of your assignments before you start them. And I like to read my rubric again when I think I'm done with something, especially if you're doing a paper, which we don't have any for this class, but it might help you with other classes. Make sure that you captured everything that's on the rubric. Make sure to do all your assignments. And then study and complete your quizzes and exams. Make sure you attend the review sessions for the exams. Those will be really helpful. Okay. Sorry, guys. Make sure to keep in contact with me. Let me know if you have anything come up, like if we're scheduled for class and you don't have power. Let me know so that I know there's extenuating circumstances. If you're going to miss class for any reason, let me know ahead of time. I can work with you if you tell me in advance, but if you don't tell me until afterwards, I can't do anything to help you. Make sure you have a reliable internet connection and computer to work from. And then schedule out your time so that you know you have enough time to complete your work. Try and find somewhere that's distraction free. I know that's really, really hard sometimes, but try and create a cubby for yourself to be able to work from. And then read all your assignment directions carefully. You want to log into class 4 to 5 times a week to stay connected and engaged, which is pretty easy when you're having to log in for class, do your discussions, and submit assignments. Make sure that you review your course announcements at least weekly. We will post things we'll post at least once a week. If anything comes up, any changes, we'll let you know through the announcements. Make sure that you submit all the assignments on the week that they're due. That includes your discussions. Your discussions are only open that week. And towards the end of the week, each week, review your assignments for the next week so you have a good idea of what's happening. So you guys already figured out how to log into Canvas, which is great. Make sure that you have your syllabus and you can refer to it often, so that you know what's coming up. Make sure that you have the right textbooks and editions. I think we've kind of covered that with the calculations issue. If you have anything that doesn't seem to match or you're missing something, reach out to me so that I can help you figure out how we get it to you. Ways to increase your learning. Make sure that you come to class prepared so that you can engage in conversation. I really don't want to be lecturing for 2 hours. I'd rather have a discussion, do some interactive activities. That will help you learn a lot more than just listening to me jabber at you for 2 hours. Make sure to attend the additional review sessions if you can. Those will be really, really helpful in your studying to help guide you to the information that is really important. If you have things that are difficult to understand, make sure you contact me and we can meet during office hours. My office hours are before and after class, but if that doesn't work for you because of scheduling or whatever, just reach out to me and let me know. I can be flexible with when we can meet. We'll definitely make sure that we find a time that works for you. Tutoring sessions are also available. If I see a need that tutoring will be helpful, I will let you know. But if you want to be proactive and schedule tutoring sessions, then those are also available. And then if you have technical difficulties, then contact technical support, or you can let me know and I can try and help walk you through it. The weekly review sessions are not mandatory, but they are highly encouraged. And then, like I said, I do offer one-on-one tutoring if you feel like that would be beneficial. Okay, this is the grading scale from your syllabus. Your key graded assessments are your unit exams, quizzes, and then your specialty exam. Those count for 80% of your grade. And then 20% of your grade is homework. So your discussion questions, your NCLEX questions, your CJ Sim, and then your HESI assignment and practice exams. For grades, homework grades will be turned off for weeks 1 through 5, so that you know that you've met your 78% benchmark for passing on just your key graded assignments. On week 6, we'll turn them back on your homework scores, so you get an idea of what your overall grade is going to be around midterms. And then week 8, we'll go back to turning them off so you can see just your key graded assignments. So you make sure that you hit that 78% benchmark in order to pass. And homework scores stay off until after you do your remediation for HESI. Your combined scores on your quizzes, exams, and specialty exam in the course has to be 78% or above before you get any credit for your homework. So you have that minimum passing grade of a 78 that is required before and after homework. Quizzes are part of your key graded assignments, and those are completed during class time. So they are at the beginning of the class. You only get one attempt on the quiz, and you get 15 minutes for 10 questions. They're all 10-question quizzes, and they all have 15 minutes. Make sure that you submit your quiz as soon as you're done with them. Exams are scheduled and given through ExamSoft. So you can log into that through Canvas, and then make sure that you read the exam description carefully so that you know what's required of you. Once you're finished, make sure that you save and upload your results or your exam answers, I guess. And then after you submit, you'll get a confirmation that it was successfully submitted, and then make sure that you log out of the testing site when you're finished. If for some reason you have technical issues while you're taking an exam, don't fret. Even if your computer crashes, ExamSoft keeps track of everything. So even if your computer crashes and you can't submit your exam, IT is able to submit it for you. So don't panic if something happens in the middle of an exam. You're only allowed one attempt on exams. You can't stop, pause, or resume. If you are having technical difficulties, stop the exam and notify myself. They are timed because we want to prepare you for HESI and NCLEX. Anyone with accommodations needs to notify your instructors at the beginning of the term. Notifications less than 10 days before an exam may not be able to be granted in time. Exams are held during our scheduled class time. The only exception is with prior written approval from the dean. So if you're going to miss an exam, you need to let us know ahead of time so that we can reschedule that for you. If you don't take an exam during scheduled class time, it is resulted in an absence, and you cannot make that time up. And then exams can only be proctored with a faculty member on campus with 72 hours notice, and has to be done during the scheduled class time. Exams are Zoom proctored. You have to be on the camera the entire time. You have to show photo ID prior to starting the exam. And then you have to be able to give us a 360-degree view of your area. And we have to be able to see your ears, so we know if you're listening to somebody telling you answers. Missed exams are held to the late work policy. So missed exams without a prior notice will be a 0. If you miss for personal reasons, you have the late penalty as long as you notify me ahead of time. So you have up to 7 days to complete it. Exams missed due to an emergency required documentation that has to be submitted to the dean. And has to occur within 24 hours of the scheduled exam. And we have to have your documentation before we can reschedule anything. And then any exam not rescheduled within 7 days of the class time results in a 0. Make sure you contact me if you have any issues that would prevent you from being successful on an exam. If you contact me ahead of time, I can work with you. If you wait until after, then I can't do anything for you. And we really want you to be successful. So I really want to do everything in my power to make sure that we can accommodate you and that you have a chance to do your best. But in order to do that, I need to know ahead of time. If you just have problems or need additional help, please contact me. I can definitely be of assistance. Okay, moving on to homework. Make sure to review your syllabus, ask any questions that you have about that. Make sure you know what is needed to complete your task. Schedule your homework on a calendar if you need to. Prioritize your due dates. Make sure you have enough time for each assignment and schedule them out if you need to. Make sure you do the readings and follow the instructions. And then that's it. Make sure that you submit your work. So this is just an example of a calendar and blocking everything out based on your syllabus. Okay, late work is not accepted without prior approval. If the instructor approves your late assignment, you do get points deducted. So 1 to 7 calendar days is a 10% reduction. Anything turned in after 8 days is a 0. And we complete our weekly grades by Tuesday midnight. Questions for NCLEX. So you will have sections of NCLEX questions that are due. They're listed out in the modules. Make sure that you open the module and it'll list out exactly what NCLEX questions are due. And it tells you how to save and submit as well. So yeah, just follow the directions, make sure you complete all 50 questions, and then submit according to the directions in the module there. Once you submit, the score that you submit is the one that you will receive. You can repeat the questions as many times as you want to before you submit them to me. And then make sure you submit your highest score. Your course text and online references are going to help with your NCLEX questions. Your percentage score will be applied to your total assignment points. Screenshots are not acceptable. Make sure that you follow the directions in the syllabus for submission. So 1 point per question. So if you do 50 questions, you have 40 correct, then you're going to get an 80% on your assignment. No bonus points for getting the most correct. CJ Sims are new to us. So make sure that you complete your assignment and submit a screenshot of the completion page for your best score. Make sure it has your name, the assignment, the date, and then your score. Each of the CJ Sims takes about 15 to 20 minutes, and we can see how long you took to do them. So if you're not getting a good score, but you only spent 5 minutes, there may be a correlation there. If you have questions on CJ Sim, there is a link here that takes you to their site. It's pretty user-friendly. And we do have 2 of them in this class. Okay, has the We don't have any HESI case studies, so you won't have to worry about that. Okay, so you do have your PN assignment and practice exam. Those are accessed through Canvas. So your grades transfer automatically into the gradebook from those. You have to use the link in the module. And then, oh, we don't have a case study. Okay. Okay, we don't have any papers, but we do have our discussion posts. Okay, so for our discussion questions, make sure you are using APA for your references. Try and use credible sources like online journals. I know it's really easy to just go online and Google something, but try and use academic sources if you can. So these are just some guidelines for academic sources. Make sure that you're using your own words and not just copying what somebody else said. And make sure that you're giving a rationale for your argument. Oh, I guess I should say, when you're doing your discussions, make sure that you read the full description so that you're answering all the questions. And then also look at the rubric that's included with that so that you know what I'm grading on and you can make sure that you get all of your points. So it's pretty much, did you address the topics? Did you include all of the content? Did you cite your sources? And then did you respond to the correct number of peers on time? Did you actually provide additional content or did you just summarize what they said? So that's kind of what's all included on the rubric, but just make sure that you're reading those as you're doing assignments so that you make sure that you get the full points. Okay, quizzes and exams. So exams and quizzes are timed because we want to get you used to that environment. You can only complete them once. If you start it, you have to finish it. You don't get another opportunity. You just click on the link for the quiz and then follow the instructions. If you have technical issues, don't try and continue. Notify me immediately. That way we can verify the issues that you're having. And we can make sure that you actually get to finish your exam. We don't let you just retake the exam because of technical problems. But we can work with you if things do come up. Okay, specialty exams. We're almost through this part. Specialty exams are given in a proctored environment. There's only one attempt at the HESI. You have an assigned date and time for the exam, and that exam counts for 20% of your testing grade. And the benchmark for the exam is 900. Remediation is mandatory for everybody. You have to complete 100% of your time based on your score. You'll get a report with areas of weakness when you do your HESI. And those are the areas where you want to spend your time with your remediation. Those packets are, your remediation packets are to be submitted by 1 a.m. on Tuesday of week 12. So we have a while before we get there. If you don't do your remediation, you will get a 0 on your HESI. The remediation is not a punishment. It's really to help you identify those areas where you might need a little bit more time, help you to focus your studying. It really is just a benefit to you to do the remediation so that you can pass your HESI first chance, get a great score on it. And then same thing applies to boards. So when you're ready to sit for your boards, then you know, I know my information. Just like the other exams, you do have to show your photo ID. You have to be on camera at all times. We have to be able to see your full face. And if you don't do that, then we can remove you from the exam. I think that is it for that. Does anybody have any questions on just the review of online courses? Okay. Let me pull up our other PowerPoint and we can get into our.
Excuse me, Professor.
Yeah.
I was just added to this class
Yeah.
because I'm coming from the 3 o'clock class.
Yeah.
And I already submitted my information, like our assignments with that group. Do they just come over or do I have to do it all over?
No, those should be, I should be able to get those from the other professor. You should not have to redo them all.
Excuse me,
you.
Professor.
Uh-huh.
I did not realize that they weren't due. I was thought the lecture was first before the initial post. May I do that tonight?
Yeah, you have until Sunday. You're fine. Yep.
Yeah, but I like to do it on Wednesday and Sunday. That's my routine, and I did not realize.
Yep. Yep. You're still good.
Okay, thank you.
Yep. Okay, let's get our pediatrics PowerPoint. Okay, so I did realize that the page numbers in the PowerPoint that I posted in your announcements were incorrect. They were off of an old edition. So the ones that are in here are correct. I will go back and update that. So if you're noticing that the page numbers in here don't match the page numbers that you got earlier, because I didn't realize it initially. So this week we're going to cover growth and development. And then we're also looking at infants and preschool, I believe. So kiddos are very different than adults. They're not just little tiny adults. They're in this continuous process of growing and developing. They go through all of these growth spurts, and then they'll have periods where they don't grow as much. But growth and development and meeting milestones are really important for us to be able to track, to make sure that they're doing the things that they should, and to be able to provide early developmental intervention if we need to. So the process of development is a mastery of skills that allows a kid to go from one skill to the next. So they start with rolling over, and then they progress to sitting up, and then they move to crawling. Once they're crawling, then they're walking. They're building towers, they're babbling. That progresses on to actually being able to understand what they're saying. These are all parts of development of a child. So we have physical areas, social, emotional, intellectual skills that we're measuring as these kids come to their follow-up appointments, so that we can make sure that they're on track with their peers. They're doing what we expect them to do. So by 12 months, we want them to be walking. They should be able to use their pincer grasp. They should be saying simple words like mama and dada. They can play ball with you. By 18 months, they're starting to run. They're building small towers. They've got a little bit larger vocabulary. They're up to like maybe 10 words. They're starting to feed themselves at this point, giving kisses to mom and dad. Then you get into your 3-year-olds that are climbing. They're into everything, scribbling, starting to talk in smaller sentences. And this is the point where they'll play next to somebody, but they won't necessarily play with them. We call that parallel play, where you'll play alongside somebody, but you won't necessarily be doing the same thing. Then you get into your 5-year-olds that are learning their colors and their numbers. They're starting to skip. They're starting to do role playing when they're playing with peers. Each child is going to be very different in their needs because of their development. So recognizing developmental growth and delays can assist you in developing your care plan. Also gives us the opportunity for early intervention by the healthcare team to prevent those developmental delays. So that's why we're measuring their growth. We're asking parents what they're able to do. We're really quizzing parents on what's normal for your child, so that we can figure out where they are along that path. So I want to open this up for a discussion. So our scenario is we have a father of a 14-month-old child. He's worried that his son isn't maturing properly because he doesn't talk yet. He seems small for his age and he can't walk independently. So where should a 14-month-old be on the spectrum in terms of growth and development? What things would we expect them to do?
They should be able to walk or either hold on to something and walk.
They should also be able to like crawl upstairs, make towers with cubes and say simple words.
Mm-hmm. Yep, those are all things that we would
They should
expect.
also be able to recognize just even more than just mom and dad, but they should be able to recognize their sisters and brothers.
Yep.
They should be able to feed themselves like with their fingers.
Yeah, the
Mhm.
pincher.
Yep. Yeah, those are all things that we would expect a 14-month-old to be able to do. So if you were the nurse that was talking to this father, what things would you recommend?
Try introducing interactive play.
Mm-hmm. That's a great one.
Maybe making a doctor's appointment, maybe speaking to the doc.
Mm-hmm. Yep, coming in, maybe getting some early intervention, some physical therapy, occupational therapy, maybe speech therapy at this point.
Find out about your nutrition patterns.
Yes, nutrition is huge for our pediatric patients. Yep, those are all great suggestions. This child is definitely a little bit regressed from what we would expect, definitely not meeting those milestones that we would think of. Finding out about their nutrition would definitely help us to determine, where they are on the growth chart. Are they truly behind? Are they not getting the nutrition that they need, or are they actually falling in their growth curve? making sure that we know how parents are interacting with their child. Are they playing? Do they just sit isolated all day because parents are busy doing something else? These are all things that all feed into the development and growth of a child. So we collect a lot of data about our kiddos. We look at their height and weight. We chart those on a growth chart so that we can really monitor their nutrition because that plays such a huge role in their development as they're growing and their brains are maturing. They require a lot of nutrition to go along with that. So there's different ways that we do this for our neonatal population and our infants. Then we put them on a growth, on a length board. So we have them lay flat and that's how we measure them. Takes 2 people to be able to do it because you got to hold their head and you got to straighten their legs. So we use those. Once they're able to stand on their own, then we can have them stand up in the on the scale, like we do in the doctor's office, like you and I still do. They don't necessarily measure our height, but you know, we can do it standing, we can do it laying, we can meet them where they're at. But getting those accurate measurements are so important. And then the purpose of the growth chart is to establish their nutritional status, see how they're growing. And then we already talked about some of those developmental milestones for the infants, things that you're watching for. So in box 15.2, on page 364, it really walks through all of your developmental milestones. We want to offer guidance and teaching to our families about what is expected at each milestone, and also how to support their child moving towards the next milestone. If we can let them know ahead of time what is normal and what is to be expected, it really helps them to guide their child into the progression of development. We can also encourage age-appropriate self-care. So making sure that parents know when their child is going to be able to dress themselves and start feeding themselves and practice those independent skills. That anticipatory guidance can really help them, the parents, understand their child better, know where they're at. And then we can also look at our nursing diagnoses in relation to the child's development. So you can look at breastfeeding being ineffective related to the inability of the infant to nurse properly, if they have a difficult time latching, or if mom has a poor milk supply. Those are all things that will go into your nursing diagnoses. A big one for our pediatric population is caregiver role strain for first-time parents, just related to their inexperience. They don't know what to expect because this is their first time trying to deal with a child, and it's very overwhelming and confusing, and everybody has their own opinion on what should be. And you can really go down a rabbit hole when you start researching online. So caregiver role strain is huge, especially for our first-time parents. And then if you have a medical diagnosis on top of just being a parent, that causes issues with family coping. Parents can have a really hard time dealing with a sick child, especially if they have other things going on. So if they have other children and this child is requiring a lot of their time, then you have strained relationships there. Just dealing with not feeling well. There's a lot of things that go into our kiddos, aside from just the traditional cut and dry objective things that we can see. One of the things that we evaluate regularly is the relationship between the parents and the child. Why is that so important for the process of growth and development? Why does their relationship matter?
Because that's like the first person that teaches like a child things like trust and mistrust and love and stuff like that.
Yes. Yep, absolutely.
And then not all parents are supposed to be parents when they had their children. So they'd be missing out on some things also.
Mm-hmm. Yep. A lot of times we have children that are having children and they are still trying to figure themselves out, let alone raising another human being. So we don't know what we don't know. So these are all very good things to be watching out for. It also helps us to guide our education. So every time we encounter a patient, then we should be providing education, seeing what they do know, what they don't know, where we can provide additional resources for them. These are all things that should be evaluated regularly. Looking at growth patterns, we have cephalocaudal, which goes from head to toe. And then we have proximodistal, which goes from the center out. Cephalocaudal development would be a baby being able to raise their head, and then eventually they'll be able to raise their chest also to go into a sitting position. And they learn to sit before they learn how to stand. So those are all cephalocaudal development. Proximal distal, like I said, starts at the inside out. So an infant will grasp with their whole hand before they're able to actually use their pincers. Same thing when you put a toy over top of an infant, they'll just swat at it initially before they're actually able to grab hold. So why is it important for nurses to recognize the differences between kids and adults?
Because they don't require the same things. Like they don't require the same amount of medications. They don't require, like kids actually require more calories than adults do. Stuff like that.
Yep. So they metabolize medications very differently than adults do. Their metabolic rate is completely different than adults. Their body systems are different than adults because they're not matured yet. So your infant has a very immature respiratory system, which means they are very, very likely to develop an infection or complications related to their respiratory status because it's just not developed yet. They're still growing. So knowing those normal values, their vital signs are completely different. Knowing those things will help you to make an accurate assessment, diagnosis, know how to care for these kiddos. So we have growth standards. We expect kids to reach a certain point on their growth chart. We expect them to be at a certain height and a certain weight as they age. We also expect different tissue thickness based on their age, because we know babies have a bunch of fat, and then as they start moving around, they start losing their fat. So we expect these things. And we want this to be standardized so that we can compare the measurement of one child to other children of that same demographic, so the same age, same gender. And then we compare that with their last visit. So we compare it each visit to make sure that they're making progress. And this being standardized helps us to have concrete evidence to assess our patients. So really looking at their nutrition status. Where are they at? Are they being overfed? Are they being underfed? And then we look at rate of growth to make sure that they're still on track. Are they meeting those milestones as we expect them to?
And do we also have to take into cultural differences?
Yes. Yep. So cultural differences play a huge part in growth and development. So understanding cultural norms is extremely important in knowing what to expect and how to educate a family on appropriate growth and development. Kiddos who are in good health tend to follow a consistent pattern of growth. So if we're seeing all of a sudden their growth dropping down, then something may have changed. There might be an illness or something that we need to look into. And there's a wide difference in individuals at any age. Our kiddos are very, very different. You can stick any two kids next to each other. They can be the same age. They could be born on the same day. And they can look completely different from each other. And we also have separate growth charts for boys and girls, because we all know just from experience that boys and girls mature very differently. They grow very differently from one another. So here are our growth charts. And these are probably going to be a little bit small, but we're going to try and do this. I'm going to give you a child and their weight, their age and their weight. I want you to tell me whether or not they're over or underweight. And then think about what interventions you might apply to that child, and then any additional information that you would want about that child. So if we had a 6-year-old girl who was 55 pounds, where would she fall on that growth chart? Would she be over or under weight?
Be under.
I'm trying to look myself here. If she is 6 and she is 55. Oh, sorry, guys. So she's going to be over on our pink chart. And 55 is going to put her, if you're looking at the pounds,
Is
she's
it like 90 percentile?
yeah.
Between 90 and 95.
Yep.
Okay.
I agree. That's what I saw too. Even I need to put my glasses on.
I know it's really hard to see. So what interventions would we want to recommend for parents?
Well, wouldn't we need to have her
Actually-
height also before we could have it do any recommendations, because she could just be taller?
Yeah, absolutely. Yep. Are parents tall? Is she just a tall girl? So she's actually fine for her age. She's just on the taller side. Very good things. Okay.
Add some extra activity.
Mm-hmm. Yep. What does she do normally? Does she sit and watch TV all day, or is she out playing with her friends? Okay, so we have a 4-year-old boy that is 38 pounds. What do we think about him?
I got in between 50 and 75.
Mm-hmm.
He's in a good percentile.
Yeah. Yep, that's right where we want him to be. Hanging out right in the middle. It's a great place to be. Okay, again, we would need to know his height, but in theory, he would be right where we would want him to be. So parents are doing a great job. Keep doing what you're doing. Okay, so in order to measure development, we do have a screening test that we can use. It's called the Denver Developmental Screening Test. We use it for the first 6 years of their life. And it identifies kids that can't perform the skills that we would expect them to at their age. Doesn't look at their intelligence. It's just whether or not they're meeting their milestones. And like we talked about briefly before, heredity, race, nationality, where they are within the family. So if they're an only child versus they have siblings, their gender and their environment all play huge roles in their development. So if you have an only child that doesn't get to interact with peers or have older siblings, they might not develop as quickly as a child that has 2 older siblings that play with him constantly. That child has the potential to develop a lot more quickly because they're trying to keep up with their older siblings. And then how the family is structured. So adaptation talks about how the family helps and shares their resources. And then partnership is the lines of communication in the family. So how well they work together. And then growth is just your typical growth and development. You also have affection, so overt and covert interactions of emotions among family members. And then the resolve talks about time, money, space, how they're allocated for problem prevention and solving problems. So these all help to determine their family resilience, all play into development. How would you expect homelessness to affect a child's growth and development?
If the child is homeless, they may not be eating 3 meals a day, having snacks, may not be getting adequate sleep. So that could affect a whole lot of things.
Mm-hmm. What else do we think? How do we help these families to access healthcare?
Try to refer them to adequate places that offer health services that maybe they can't afford, they can get free or at a reduced rate or something like that.
Yeah, those are great. There's a lot of community resources that are available for families.
A hungry child is going to have difficulty learning and paying attention at school, and their bodies are growing so much they can be definitely delayed in their growth.
Yeah. Yeah. So how do you as a nurse find out about these resources? How do we connect families with resources that are available to them?
Maybe they have social workers like, in the clinics that can give you different type of resources to give to them.
Yep.
And they're disciplinary.
Mhm.
Or
Direct
like
them
school
to-
nurses and school health aides have access to those resources too. And
Yeah.
you do find out about a lot of kids being homeless from being like a school health aide, because I was one. You find out about the kids who are homeless and don't have, clothes and things like that, and you do like give referrals to families.
Mhm. Those are all
Okay.
great examples.
Also,
What was that?
school counselors also,
Mhm. That's another great resource.
those resources.
Mhm.
Other children are great resources too, because they have a tendency to just tell you the truth without meaning to.
Yes. They're very good at that. Okay, so we kind of talked about this. Your environment can also affect your personality. And the development of the child's personality is really important because it helps to determine a pattern of behavior. So a lot of times you can see a typical or recurrent pattern of behavior based on their personality. So we have a lot of developmental theorists, and we are going to go through them. But there is a whole separate PowerPoint that we will not have time to cover, that I sent out in the announcements. It goes a lot deeper into these guys. So if you are struggling with keeping them separated, that is a really good resource for you. But we're gonna try and do our best here. So at birth, the child's responsibility is just to learn how to be outside of the womb. So your infant is just adjusting to their external environment. And the parent's responsibility at this point is to respond to their child's cues. So when a child cries because they're hungry or they're tired, making sure that you're meeting their needs. That is the responsibility of the parent at that point. So things that we can do as nurses immediately after birth. We want to encourage skin to skin contact, early touching, really bonding with their child, feeding, breastfeeding if we can, making sure that parents are aware of what is normal for a newborn, trying to alleviate some of their fears. Talking about reflexes such as their grasp reflex. And one of the best things that you can do for a mom is teach her that if she puts her finger in baby's hand, that they will hold her finger. That's a great bonding experience for the two of them. And this is when they're developing trust. So if I cry, I know mom's going to come and get me. Or if I'm hungry, I know mom's going to feed me. This is where they're starting to build that trust versus mistrust. So our responsibility as nurses is helping parents to identify and interpret those needs. And making sure that grandparents don't take over for the parents. The parents are the ones that are going to be there most of the time in most situations. Making sure that they're prepared for how do they meet their child's needs. And then as we move into toddlers, they're starting to develop their independence. So they're really wanting to do things on their own. And it's really difficult for parents because these babies they've raised and now they're starting to do things on their own. They don't need mom and dad as much. So being able to accept that loss of control, but still keep them safe. So really encouraging parents to let their child explore as long as they're safe, making sure that we're not hollering at them for every little thing, letting them fall down. It's okay. as long as they're, not falling off of a cliff. You got to keep them safe, but you got to let them make mistakes. Then we get into our preschool age and they're starting to assert initiative. They're starting to separate from their parents. So helping parents understand what they can let go of so that their child can be independent. And then as they move into school age, they're starting to get into industry. They're starting more learning. Their peers are becoming important to them. They're starting to learn about rejection from peers. This is when patience is so important for them, letting them do things themselves, even though we could do it so much faster. Really hard. You're running late and you really need to get out the door, but your kid really, really wants to tie their shoes. Letting them take the time to figure it out, even though you're going to be late, is really important for their growth and development. So hard to do as a parent. This is when they start doing chores too, that are age appropriate. Learning about limitations and self-discipline starts to become part of their routine. Being there to guide them, but not intruding. Getting results from their own efforts. They'll start to recognize those types of things at this age. And then we get into adolescence. And this is where your child is really trying to establish their own identity. Their identity is so important to them, and that's what their world revolves around at this point. They're starting to hit puberty. They're starting to see those changes. Their brains are starting to understand abstract reasoning for the first time. They're thinking about careers, investigating different lifestyles, and then working on controlling their feelings. We all know adolescents, their feelings are all over the place all the time, and they're just trying to figure out what end is up. So working on reining in those feelings and understanding them. During this time, it's really difficult to let them live their own life, but they need to start to develop independence and be accountable for their own actions. Expect the parents to be discredited by the teenager. Their peers' opinions and the internet's opinion is going to be way more important to them than their parents' opinion. And there's going to be differences in opinion, and the mutual respect of the fact that there are differences needs to be there. Offering guidance without pushing them a specific way is really, really important. And then as a nurse, helping parents adapt to this. Having an adolescent is really difficult. Trying to exercise control and independence at the same time is a constant battle. And then there are certain tasks at each stage that have to be, moving on to Erickson, sorry, this kind of just hard stop there. So Erickson looks at certain tasks that have to be mastered in order to achieve maturity. So each task is built on successful completion of the previous stage. So this looks at parents and their interactions with their kiddos to assist in mastering these stages. So that is Erickson in a nutshell. Piaget focuses on our cognitive development. So we're looking at their intellectual ability, and maturity is attained through the orderly, distinct stages of development, starting with our sensory motor, our pre-operational, our concrete operational, and our formal operations. Each stage is approximate at when the child will hit it, and they build on each other. And it looks at your interactions and coping with the environment. Kohlberg is also sequential. He builds off of Piaget. You've got your pre-conventional, which is where you're exercising obedience out of fear of punishment. Then you've got your conventional, where you're just worried about conformity and being loyal. And then post-conventional, where you have your own morals that are guiding your decision-making. So parent teaching is really important in understanding their child better. So dealing with challenges and disappointments prepares for independence and adulthood. Encouraging your child to deal with successes and failures. Finding socially acceptable outlets for dealing with these emotions. Letting them have their emotions and only intervening when they become frustrated or overwhelmed. And then helping parents to assign tasks to help them through each stage of development. We talked about nutritional heritage. Some families don't consider food a priority. That lack of adequate nutrition can lead to delays, developmental delays. And then you have an obese child that can have decreased motor skills, or face peer rejection because of their stature. So being able to identify kids that are at risk and getting them the help that they need to modify their eating habits in whatever way is appropriate for them. There is a table on page 372. It's table 15.6 that talks about culturally diverse food patterns.
It's on page 375 for some.
Oh, thank you. Okay, so why is, hang on, let me back up here. So we don't want to restrict fat or cholesterol in pediatric patients because those are crucial for central nervous system development. And then as our kids are experiencing illness, their nutritional needs also change. So sometimes we have to add in TPN, so total parenteral nutrition, which is IV nutrition, or we can add in tube feedings to help support kids while they're sick, or if they need them at home long-term, we can also do that. Why do we do these interventions? Why is the development of the central nervous system so crucial during the first year of life?
Is it because that's when they learn like all of their skills, like their gross motor skills, fine motor skills, brain develops and stuff like that?
Yeah, they do a ton of growing their first year. Their brain matures, all of their organs are maturing. They're learning all of these skills that are foundational to being a successful toddler, child, adolescent, adult. All of that happens during the first year of life. So that's why we harp on nutrition so much for our infants. So looking at that, we see signs of underfeeding. You have a kid that's always fussy, they're always crying, failing to gain weight. These kids might need extra calories. A lot of times they spend so much time eating because they're hungry all the time, but they burn so many calories constantly eating that they never have a chance to catch up. So sometimes these kids need a really high calorie diet to be able to meet their metabolism so that they're not expending so much energy trying to grow. Then you have the opposite spectrum where you have overfeeding, where these kids are constantly vomiting, they have diarrhea, or they're putting on weight really, really quickly. Those kiddos, we might have to limit feeds, we might have to space out their feeds, we might have to change a formula. High fat diets are cause for delayed gastric emptying, can cause abdominal distension or discomfort. High carbs do the same thing, may cause additional gas, excessive weight gain. Constipation can be from too much fat or protein, or a deficiency in bulk in the diet. So not having things that help push through your intestines. We don't want to introduce whole milk before 1 year of age. And we don't want to do low fat milk before 2. Why is that? Does anybody know?
Because the stomach cannot break down the fats in the milk.
Right. Yep. Their stomach, their intestinal system, GI system is not mature enough to be able to break down the complex fats that are in whole milk. And then what about low fat milk?
Fat milk doesn't have
enough nutrients.
Right. Yep. They need that fat at 2 years, before 2 years of age. That fat is really important for their growth. So by the end of the second year, we're expecting kids to be able to feed themselves. And that's where they're exercising their independence. Parents should still be present at meal times because they're not going to be reliable to safely or efficiently feed themselves. And a lot of parents experience anxiety around this time. This is a great time for finger foods. Exploring foods with their hands is a great way for them to learn textures and things. And then they are more vulnerable to your protein and calorie deficiencies at this age when we're in our preschool population. During school age, we've got an unpredictable attitude towards food. Sometimes it's great, sometimes we want nothing to do with it. Intake of our protein, calcium, vitamins tends to be lower. This is where we get more excited about junk foods and sweets and empty calories than we do nutritious choices. Adolescents are, again, growing rapidly. This is another big growth spurt for them. They're expending a lot of energy. It's important that adolescents are involved in their food selections, but making sure that they're choosing things that are both nutritious and appetizing. This is where a lot of fads come in with their choices. Their peers are a huge influence on what they choose to eat. And then because of the lack of nutrition, a lot of times fatigue is very common in this age group. Childhood obesity is still a struggle, has more than doubled in the last 30 years. And it's also related to obesity in adulthood, can cause problems like high cholesterol, high blood pressure. Most often it's related to the diet, just fast foods or easy things that aren't necessarily nutritious, followed by inactivity. We measure this a lot through their BMI, so their basic or basal metabolic index, which looks at their weight in relation to their height. A lot of kids in the hospital just don't feel like eating depending on their illness. It's really common for them to refuse foods. Making sure that we're accommodating their needs, whatever sounds good that might be nutritious, that gets them the calories that they need, that's what we give them. A good kind of gauge for how much a child should eat is a tablespoon of food for each year. Sweet drinks and snacks should be avoided before a meal. Babies that are placed on NPO status need to have a pacifier so that they can still practice their sucking. It builds their skills. It's also a great method for self-soothing. We want to make sure not to neglect baby teeth. They help with the digestive process and also jaw development. So if we don't take care of those teeth, then our permanent teeth can come in poorly aligned. And then it's also indicative of certain endocrine disorders or pathologic conditions. We want to make sure that we're brushing our teeth to avoid cavities, making sure that we're getting rid of sugary drinks, milk before they go to bed, avoiding high sugar foods. Teeth brushing starts with the first tooth erupting, brushing before bedtime so that we get the bactericidal effects of our saliva before we go to sleep, because those drop off. Fever is not associated with teething. Some kids will get a fever with teething, but that's coincidence more than anything. Making sure that we're replacing our toothbrush regularly, not using a closed container. Cold or dark closed environments are great breeding grounds for bacteria. Not sharing toothbrushes. Health problems can also affect our teeth. So sucrose in medication can cause tooth decay. Certain medications cause bleeding, impaired healing. They can cause erosion of teeth from your vomiting. And then moving on to play. Play is the work of children. That is how they learn. That is how they grow. That is their number one priority, is playing. So hospital playrooms are safe zones. As long as the kid doesn't have a communicable illness, a playroom is a great place for them. We want them to continue to work on their development. This is not a place where we want to do a procedure. We want to optimize their play in age-appropriate ways, helping parents select age-appropriate toys, making sure that if your kiddo's not in, or if your kid's in the hospital for an asthma exacerbation, you're probably not going to want to bring a bunch of stuffed animals or things that have loose fur, fuzzy blankets, things that could make that asthma exacerbation worse. So just thinking through those things and helping parents make those good decisions. Okay, so that's kind of growth and development overall. Now we're going to move into specifically infants. We'll talk more about those milestones. So the milestones or developmental goals are referred to as norms. Understanding what the normal range for their milestone developments is really important for the nurse. So your infants are going to be focusing on their sleep-wake cycle. They're starting to do social smiles, eventually drinking from a cup. They're experiencing separation anxiety. Making sure that we tell parents when a child suddenly stops progressing or does things that aren't typical for their age, it's a sign that they need to be evaluated by a healthcare professional. This could be, an illness coming on. It could be a true developmental delay that needs to be addressed. But if kids start reverting to things that they haven't done or aren't meeting those milestones, they really need to be seen by a professional. Vital signs are very different. So our respirations for pediatric patients, our babies have very abdominal breathing patterns. So they are belly breathers. Their belly moves up and down instead of their chest moving up and down when they're breathing. They also breathe much faster. They have a higher pulse. We take their temperature axillary. Their blood pressure is much lower than an adult because they don't have the same blood volume. And just everything is very different than an adult. They change as they progress or as they age. Infants are also reliant on the oral stage. So sucking is a source of comfort and relief of tension for them. It's really important that they're held during a feeding so they feel that love and security while they're having their needs met. Making sure that we give them enough time for that suck, swallow, breathe reflex. Infants might need IV nutrition or IV fluids in addition to their pacifier to meet those needs. Your grasp reflex will start disappearing at 3 months of age. And then you get your parachute reflex that starts around 7 to 9 months, where they will kind of stretch out if they're suspended by their trunk. And then our pincer grasp should be well established by the first year. So those are all motor development things that we expect them to do. For emotional development, consistency is so important for these infants, helps them develop that trust and understanding that their needs are going to be met when they do certain things. Infants that are consistently picked up when they cry will have fewer crying episodes and less aggressive behaviors as toddlers because they know that they're going to have their needs met. When they start learning a task, parents should provide encouragement to help them to understand that that's a good thing. They're doing the right thing. Sensory stimulation is really important for development so that they develop all of their senses. Crying should be soothed. If a baby's hungry, you should feed them. Warmth and affection are recognized by an infant, as well as the lack of these things. They all play into the infant's understanding of the environment around them. No two babies are going to be the same. A lot of physical patterns can't be separated from their social patterns. And then abrupt changes don't take place with each new month of life. If a baby doesn't fit into the norm, then we need to intervene to prevent those developmental delays. So our responsibility as nurses is to guide our parents in obtaining the skills that they need to promote growth and development. Community referrals can be really helpful to meet some of their needs. Irritable infants are also cause for concern. Irritability or lethargy, a lot of the same interventions are used. Irritable babies are difficult to soothe. That's why they're irritable. A lethargic baby can just shut down and sleep in order to avoid being overstimulated. So a lot of times these babies need the same interventions. One of the things that we can do for them is shielding their eyes from bright light. A lot of times light is extremely overstimulating to a baby. So if you have a baby that is really fussy, if you turn the lights down, lower the noises in the room, they might calm down. Same thing, your kiddo might be acting lethargic because they're completely overstimulated and they don't know how to process all the information that's coming at them. So things to do for them: sit quietly, keep the room quiet. You don't want any extra noises. Talk in a soft voice. If you can swaddle them tightly, that's really helpful for them. Hands to their face, especially for your younger infants, that is a very comforting position for them. Helps them to self-regulate. And then that non-nutritive sucking will also help with self-regulation. Here you can see a picture of the colic carry. These kiddos can have unexplained irritability and crying in an otherwise healthy infant. Parents can be extremely overwhelmed with a colicky infant, and helping guide them through how to intervene is really important. Like we talked about, lethargic infants could simply be responding to excessive stimulation by shutting down. Dim the lights, move very slowly, firm containment for them, talk in a calm voice, do everything slowly, gently, no sudden movements for these kiddos. And just really watching their face and their body for their cues to tell how they're feeling, what's going on. So talking about sleep patterns, your normal newborn sleeps in 3 to 4 hour intervals. By 4 to 6 months, they should be sleeping up to 8 hours at a time. And then synchronizing their circadian rhythm into the family routine is a learned behavior. So when you're born, everybody has their own clock, they're on their own schedule, but fitting the schedules together into a family unit is a learned behavior. It happens over time. Babies should be on a firm mattress on their back, nothing soft. They should be alone in the crib. And they will rely on parents to soothe them if they wake during the night. And they will eventually learn how to self-soothe, but that's something that happens over time. For illness prevention, we want to stress the importance of attending their pediatrician visits, making sure they get their vaccinations on time, providing that education and anticipatory guidance for those developmental stages. Making sure that they're changing diapers on time. A lot of times that can be a financial stress for families. Diapers are expensive, and when their kid is constantly going through them, it may be something that gets pushed to the wayside. But it's so important for their skin and their development that they get changed regularly. Making sure that we're watching their growth. They're getting adequate fluid, adequate nutrition. They should be seen by a physician at least 5 times in the first year. They'll have hearing and vision assessments. We do screening tests that are mandated by each state. We follow their growth and the development through those screenings, immunizations. We do nutritional counseling. All of these things happen regularly at these visits, and will help to prevent illness. Infants with special needs, we can set up early intervention to help them achieve their best outcomes. We can do this through community referrals, also inpatient referrals, speech therapy, cognitive therapy, neurodevelopmental You can have your physical therapy, occupational therapy, all of these things work together to make sure that these kids are meeting their developmental milestones to the best of their ability. Immunizations, it's really important that they are on time and that they receive all of their immunizations. Delays in starting them can lead to serious illness or even death. And then accurate records of the immunizations can prevent confusion and duplication if parents move or change providers. For nutrition, we can slowly add solid foods around 6 months of age. This is when the extrusion reflex has disappeared completely, where they push food out of their mouth with their tongue. And we do have a mature GI tract at this point. Between 4 and 6 months is when our sucking is more mature. We start developing that munching or that up and down chewing, chomping motion. Make sure that when you're teaching about nutrition, you assess the parent's knowledge level, the infant's development, their interactions together, any cultural differences or things that might come up. And looking at how well the child is being fed, we look at their weight. We look to see if they're gaining 4 to 7 ounces a week for the first 6 months. We want them to double their birth weight by 6 months, triple it by a year. Making sure that they're having at least 6 wet diapers a day, at least 1 dirty diaper a day, and that they can sleep peacefully for several hours after a feeding. If they're waking constantly, then they might not be getting the nutrition that they need. Human milk is best for infants under 6 months. Formulas that are cow's milk based and iron fortified are recommended by the AAP. And like we said, no whole cow's milk until after a year of age. Prebiotics and probiotics can be found in formula. Your prebiotic helps to stimulate your bacteria in your gut, so your good bacteria, and it keeps the balance of your GI tract. Your probiotics are protective of your GI tract. They're used to treat diarrhea. For bottle feeding, make sure that you're not feeding expired formula. And following directions on mixing, storing, and how you're giving the formula to the infant. You want to make sure you always use clean containers to mix and store. Never heat a bottle in a microwave because it heats unevenly and you could have hot spots that can burn the child. And then we can't save formula that's been used from a feeding. The bacteria from the saliva on the bottle can get into the milk, can cause diarrhea. As we add solid foods, making sure not to introduce food when the child is ill. We might not be able to tell the difference between an adverse reaction and an allergy at this point. Rice cereal is usually the first food. Because it's easily digestible, not typically an allergen. Making sure that we're introducing one food at a time in small amounts. And then making sure that we're not introducing things that are known allergens. So things that are consistently could cause an allergic reaction. When introducing new foods, introduce them before you give milk, so that the baby's hungry and ready to eat. And as you're increasing your solid food intake, you'll decrease your formula or milk. Infants require almost 3 times more calories per kilo of weight than adults. Easily digestible fats are needed for that brain growth. And then by 6 months of age, they have that mature GI tract that can digest the more complex fats in food. So for nursing interventions for nutrition, we want to encourage breastfeeding, discourage overfeeding, teach moms the signs of cues, whether their baby's full, whether their baby's hungry. And then we want to prevent the early introduction of solid foods. Signs of readiness include looking forward to new tastes and textures, may not want to be held super close during a feeding. As they get older, infants might start to bite as they're getting teeth to come through, and they might follow their parents and their siblings. They might try and do what they're doing. Those are all times when we want to start weaning milk and start introducing foods. We want to make sure that the foods that we introduce don't have any additives in them. There's not been much evidence to show that organic foods are superior to non-organic. It's just the overall nutritional value of the food that you want to look at, and you really want to look at the food labels. We talked about this already. By 4 to 6 months of age, they're starting to develop those more advanced feeding skills. Their sucking is more mature. They're getting that munching up and down pattern. Around 5 to 6 months of age, you can start introducing fruit juice. When they start drinking from a cup, want to hold off on orange juice until 1 year of age because of allergies. We talked about rice cereal. We only start with small amounts, approximately a teaspoon, making sure when you're feeding an infant that you put it on the back of their tongue. And then one single ingredient at a time so that you can really assess for allergies. And you only want to offer a new food in a 4-day to 1 week period to develop their tolerance. So, you start with peas for 4 days and then you move to carrots. So you know how they feel about peas, and then you can tell how they feel about carrots. You don't mix foods every day, so you don't know what's expected. Car seat safety. Babies need to be rear facing until they're 2 or the weight limit on the car seat. Fall prevention is also huge for these kids, making sure that they're never unattended on a flat surface. Crib rails need to be up and locked, protecting them from stairways, pools, anywhere that they could get injured. Toy safety, they should be age appropriate for where they are on the developmental scale, making sure that nothing can be swallowed. Their response to a toy might be an indication that they're ready to learn a new skill. And then kind of summary of our overall development. Our weight doubles by 6 months, triples by a year. Our head and chest circumference should be equal by 1 year of age. And then babies are on their own when it comes to iron at 6 months of age, which is why iron is so important in their formula. Their maternal iron stores are dropping, so they need a lot of iron to help build their own. By 9 months of age, their depth perception begins to develop. We start rolling over at 4 months. By a year, we're starting to take independent steps. Those primitive reflexes at birth are starting to get replaced by voluntary movements. And then we start getting teeth at about 6 months. Okay, we made it through infants. Let's breeze through toddlers so we can get out of here. Toddlers is our 1 to 3 year olds. They're no longer completely dependent on others. They're rapidly growing. This is when they're learning autonomy versus shame and doubt. Safety is huge. These kids are starting to explore their environment. Maintaining a positive self-image is important. Constantly hearing no and negative things can lead to delays in development, them being afraid to explore and learn. They're learning self-control and how to deal with anger and aggression in an acceptable form. They're very ritualistic. They're very used to their routine and they want their routine. By 2.5 years, they've quadrupled their birth weight. Their brain growth starts to slow. Their head and their trunk start to grow more slowly at this point. Their bones are beginning to ossify. Their big baby bellies start to go away as their abdominal muscles increase. And then they're also getting myelination of their spinal cord at this time. Usually they get bowel and bladder control by 2.5 to 3 years. These are all things to be expected. Still belly breathers, but they're starting to shift into that thoracic breathing as they get school age. This is when they're starting to maintain a stable body temperature and not so reliant on environmental factors. They're starting to move towards that 3 meal a day schedule because their digestive system is mature now at this point. Their sensory and their motor abilities aren't independent yet. They start to strengthen their memory. They can remember directions. They can complete multiple things in a row. Piaget's sensory motor and preconceptual phases emerge very rapidly. We're looking at milestones for toilet training, feeding, dressing, speech, being curious about the environment. Hopefully this doesn't fly. Okay. They're starting to work on toilet training, and along with that, they might have a panic moment because they don't understand essential versus non-essential body parts. So when they see their urine or their feces going down the toilet, they think they just flushed part of themselves away. Teaching parents that this is a normal process of thinking is really important so that parents understand why their kid is freaking out.
You know, Professor, when my oldest grandson had his first BM,
Yeah.
and it scared him so badly, and I was sitting there with him. You had to pick him up, and he was on the potty because he was like, "Oh no, no!" And I didn't realize at the time that was scaring him. I thought it was just because it was hard and coming out.
Yep. Nope. He thought a part of him was missing now.
Right.
Yep. Yeah, that they don't understand abstract thought at this point. So to them, that was inside of me and now it's outside of me. So that's a part of me. So yeah, I mean, it's hard for us as adults to understand, but that's where their mind is at the point. So with their speech, what they understand exceeds what they can actually say. They start recognizing and being able to repeat words that they hear often. They'll respond to your tone of voice and facial expressions. Making sure that we empathize with a toddler that's trying to communicate will help them not feel frustrated when they're having difficulty getting their words out. Screening for autism, you'll see these developmental delays. They're not pointing, they're not gesturing by a year, they're not speaking by 16 months. They're not able to put 2 words together by 24 months. they may regress and they may have a loss of achieved language. We need to make sure that we're ruling out other factors like lead poisoning, hearing deficits, disorders, instead of, well, along with the autism spectrum. Toddlers, we really need to teach them as opposed to punishing them, helping them understand reasoning for things, more guidance as opposed to discipline. Parents' responses to temper tantrums either reinforce the temper tantrum or can help to alleviate them. Your expectations have to be in line with the child's development. So setting limits, using timeouts, making sure that the timeouts are appropriate for their age. So they typically say 1 minute per year of age is appropriate for a timeout. They're seeking approval. Using a positive approach is important for these kids. It increases their self-confidence. Using fear or physical aggression doesn't foster self-control. It can lead to a cycle of abuse. Fear-provoking events can affect a toddler's reaction. So, by themselves, if they didn't know that they should be afraid, like they might be afraid, but once they know that they should be afraid, it's a lot harder for them to recover from something. Same thing with stress. Stress increases fear of separation. So if they don't know how to self-console or self-soothe, they're going to have more of that separation anxiety. When you're talking to a toddler, it's great to be on eye level with them. It's less overwhelming for them. Having a flexible schedule is important. Clothing, these kids are starting to be independent. They're not going to be on your timetable. Clothing should be easy to put on and take off because they're starting to learn how to do these things on their own. Sunburn protection is really important for them. Their skin's not fully developed yet. Making sure their shoes fit so that they can develop their walking skills. And posture is influenced by that as well. We're working on toilet independence. They have voluntary control of their anal and urethral sphincters between 18 and 24 months of age. So that's when parents typically start thinking about toilet training. You can use a potty chair or put them backwards on the toilet. We usually try bowel training first because they have a little bit more control over it. Don't leave them unattended. Bladder training can begin when they can stay dry for 2 hours at a time. Their calories start to decline. They need a lot less milk. We talked about serving size, making sure that food is chopped into fine pieces that they won't choke on, and a big priority for finger foods. Picky eaters can be selective about what they want to eat, but will maintain enough nutrition to grow. If a kid is refusing to eat and they're not growing, that's when we might need to look into a feeding disorder. Daycares, there's a wide variety out there: personal preference, cultural preference, financial and special needs, all play a role in determining the appropriate daycare. They should be a state approved daycare. Yes. Sorry, I was catching up on our chat here. Bowel training when they go and hide. Yeah, they're hiding because they're pooping somewhere. And then COVID babies. COVID babies are kind of a conundrum. So depending on what their home environment was like, depends on whether or not they're more advanced or they're delayed. So if they had parents that were really engaged with them, or they had older siblings and they spent a lot more time confined in the environment together interacting, then they would have the potential to be more advanced than your typical toddler. If they were, mom and dad were busy with the older kids doing schoolwork, didn't have time to attend to the younger one, they were left to their own devices, they may actually be delayed. Or if parents just gave in to their every need, they didn't have to use their words, they just had to grunt for things or point to things, their speech may be delayed because parents were just, I've got so much going on that it's just easier for me to give this to you than make you tell me exactly what you want. So those are things that all kind of came out of COVID that we're starting to see now. Our poor teachers are just inundated with all of these kids and where they're at in the varying developmental milestones right now. Other things for toddlers with daycares, they have a short attention span, and they're still engaged in that parallel play rather than playing together. So they're in need of closer supervision for safety reasons. It's really, really difficult for parents to let go and allow their toddler to interact with somebody outside of the family. So daycare is a huge adjustment for the family as a whole. The infant learning how to interact with a stranger, the parent releasing control to a stranger to raise their child. All of these things are a huge, huge adjustment for the family. Injury prevention, the best prevention is knowledge, knowing what's appropriate for their age group, knowing what to expect. Parents need to understand their child's activities so that they can prevent injury. Toddlers are on the move. They're always into something. Car seats still apply in this age group, making sure that their car seat is fit appropriately. They're following the manufacturer's guidelines, making sure they're rear facing, they're following the weights. Other things that are important are non-flammable sleepwear, childproof caps on your medications. Water temperature is huge for these kids. Their skin is very sensitive still. Your smoke and carbon monoxide detectors, the slat space in your infant crib. So making sure that as they're learning how to pull themselves up and stand independently, that they're not going to tumble right over the side rail. Routinely inspecting toys for degradation and making sure that they're still appropriate. Making sure that the toys that they have are helping to develop their skills. We talked about parallel play. Childproofing the home as they're getting more mobile. Huge. That is it. That is toddlers. Do you guys have any questions about things?